Can't hear you, sir. Your mic is muted.
The mic is mute. Thank you. I didn't know it. So, anatomy is the main bulk of the exam. The RTS clear that 75 questions pure anatomy will be in your exam. But let me tell you that it's overlapping with many chapters. It will be overlapping with trauma, orthopedics, tumors, as well as the pathology, and every subspecialty in surgery. There is no surgery without anatomy. So, if you master the anatomy, you have mastered the MRCS exam. So, keep this always in your mind. And luckily, the 75 questions are clearly categorized in MRCS. So, if you have a chapter you are lagging behind, don't worry. You have the whole chapters, the other chapters, you can master them. But believe me, those 75 marks are not forgivable to lose any one of them. And regarding the embryology, how to study embryology? The embryology is overlapping with all the chapters, especially the pediatrics. So in embryology, it's not only the 8 questions in the EMRCS scope, but the embryology in the all chapters overlapping with the embryology, especially the pediatrics and the congenital anomalies in every chapters, like the head and neck congenital anomalies. This is embryology. When I talk about the cleft lip and cleft palate, is it an embryology or it's a congenital anomaly in the pediatrics or it's a plastic surgery? So it's all overlapping. It's a trick. The exam mainly in MRCS, I will repeat it again, it's all about the trauma, orthopedics, and preoperative, postoperative, as well as anatomy. So anatomy is the main bulk of the exam. And to make sure you understand this well, do you know how many questions in orthopedics is stated in the Royal College? It's about 9. Do you believe that the exam will only get 9 questions in orthopedics? Everyone entered the MRCS exam, got out, and said it's just an orthopedic and the trauma. Yes, because the orthopedics is overlapping with anatomy. Clear? So
Yes.
Yeah.
I want you to
Yes, yes,
understand that anatomy is your main scope. You don't forgive yourself to lose any mark on this, but take it piecemeal when it gets harder. And together, let's focus on what is needed to be focused on in anatomy. And regarding embryology, never make an MD in the embryology. Yes, we have 5 to 8 questions, but overlapping. So take it piecemeal. If we studied embryology from the beginning, formally, it will be a headache in your mind. So don't do this. Just focus in the main anatomy. It has its own headache already. Yet it sometimes have very interesting topics. How to add? Someone is trying to add. Okay. Let's start with the anatomy of the very beloved. When you see this, you think about the breast. The breast in embryology, modified sweat gland, important for lactation. The boundaries are very important from the second rib above and below to the sixth rib. Medially, you will have the sternum. Laterally, you will have what is laterally?
The axilla.
Axilla.
Anterior axillary line.
The mid axillary line. I like this. Yes, it's the mid axillary line. And the breast is resting on many muscles. What is the bedding of the breast? It will be the pectoralis major and minor.
Pectoralis major.
both the pectoralis major and minor, as well as the serratus anterior. So this is important. In MRCS Part A, he is not focusing on the origin and the insertion. It's not the main scope of the exam yet, even though he can ask about them. But in your exam, don't focus on those mainly, to be honest. So, how many loops we have in the female breast? We have around 15 to 20 loops, arranged like radiation, like this. And those loops are glandular tissue embedded in fat. They cause the smooth contour of the breast. And we have what is called a ligament of Cooper. The ligament of Cooper is very important, Cooper's ligament, because if any pathology occurred in the breast, in the superficial and deep fascia, it's connected by this Cooper's ligament. So any tethering in the breast will be due to this Cooper's ligament. And this very famous MCQ to be asked in the exam. And the logic behind it is the Cooper's ligament is what is connecting the superficial and deep fascia of the breast. These are fibrous septi running from the subcutaneous tissue to the fascia of the chest wall. It's called the ligaments of Cooper's. And each lobule of those lobules have many lactiferous ducts that opens in the areola. Every one with multiple numerous opening in the areola. And remember, we talked about in stress the prolactin increase so the mother can lactate her baby. Thank God. The male breast, in the contrast, is it a gland or not? The male breast is a rudimentary, comprised of small duct without alveoli, while those lobules in the male breast composed of hundreds of alveoli. Yes, you heard it correctly, alveoli. So alveoli is like a bag. Alveoli is like a bag. That's why we have, yes, alveoli in our lung and alveoli in our breast. But the alveoli in the lung, it has air and surfactant, while in the breast, we have the alveoli to secrete the milk. Clear? So
Yes, sir.
the mother in humans can take a soothing cream after lactating her baby, right? But in animals, they don't have creams. They don't have a pharmacy to buy it and don't have owners always to look after them. So, what can be used as a lubrication for the areola gland of Montgomery? I talked. So, the area of the nipple is lubricated by the Montgomery. What is the Montgomery? It's a modified sebaceous cyst that is a gland. God created it to make lubrication signal for the nipple and areola. And take care, if it have become infected, it's a very serious issue. And now, let's back to our exam. What is the main blood supply of the breast?
Internal memory artery.
Internal mammary artery perforators. And the internal mammary artery is a branch from
Subclavian artery.
subclavian artery. What other blood supply can be given for the breast?
Intercostal arteries.
Yes, the lateral intercostal arteries. We have here lateral intercostal arteries. What else?
Lateral thoracic artery.
Mm.
Lateral thoracic artery. Very good. lateral thoracic, and here the acromioclavicular, acromiothoracic. And let's say the subclavian artery becomes the axillary artery. When the subclavian becomes the axillary,
At outer border of the first rib.
again, I can't hear you.
At the outer border of the first rib.
So give me a landmark. A landmark when I say I found this, so I became in the axilla. Like a muscle.
Outer border of
Constant.
pectoralis minor.
Outer border of
Big-
pectoralis minor.
Yes, it's a pectoralis minor. You are such great surgeons. So the subclavian giving us the internal memory, and internal memory is the internal thoracic artery. They are the same perforators, and this is the main blood supply of the breast. So the internal memory is medial or lateral?
Lateral.
The medial. Medial. It's medial. Right? I hear someone told lateral, or it's internet. Anyone?
It's medial actually.
Medial. That's great. So how about the sensation of the breast? We have the intercostals, of course, and lateral cutaneous, and the supraclavicular branches. Always try for the anatomy to draw yourself. Your own drawing are unforgettable, even if they are just crooked drawing and just fast drawing like this. This is the best thing to do if you want to study anatomy well. Clear? So let's continue. What can be asked? He will not ask you about the origin and insertion of the pectoralis major and minor. He will ask you what does it divide. So he will ask you that the pectoralis minor is dividing the subclavian and the axillary artery, and is dividing the upper limb from the shoulder, creating the axilla. He will ask you about the boundaries of the axilla, and here we have pyramids, and you as a human being have two pyramids in your axilla, right? So what are the boundaries of this axilla? Who can share? The medial boundary, medial border,
The lateral border of the pectoralis major.
the lateral will be
serratus anterior.
Latissimus
anterior.
dorsal.
No,
Latissimus.
medial. Serratus anterior will be medial. Look at your chest. Put your
Yeah.
hand here. Those are the serratus anterior. Those are yours, not mine.
Yeah.
So
Yeah.
those are me. How about anteriorly? Anteriorly. Anterior there will be this is the
Or
medial.
the pectoralis major, lateral border of pectoralis major.
The anterior border will be the pec major, and the medial border will be the serratus anterior, and the lateral border will be the intertubercular sulcus. Intertubercular sulcus of the humerus, right?
Yes.
How about we talked about the anterior, we talked about the medial and the lateral border. How about the posterior border?
Latissimus dorsi.
The teres major, latissimus dorsi, and the scapularis, the subscapularis. That's great. So we have here mainly the latissimus dorsi as well as the teres major or the minor, teres major or the minor, major. Why? Because I draw it. This is mainly what will be asked. Anything can be asked again in the breast? Yes. We have a very important task. The pectoralis minor, yet it's minor, yet have a very important rule. It divided our shoulder from our upper limb and made us denote the landmark for the axilla. Not only this, but do you know something about the main lymphatic drainage? We
It
have
divides the axillary lymph nodes in three levels, like level 1, level 2, and level 3.
amazing. So the axillary lymph node, which is the main lymphatic drainage of the breast, is divided into three parts, three levels. Those three levels are denoted by the pectoralis minor. Level 1, 2, and 3. Where is 1? Where is 2? Where is 3?
One is inferior
Oh,
to pec.
one is below the pectoralis minor, level 2 is behind the pectoralis minor, and level 3 is above the pectoralis minor.
Are they written here in a correct order? If this is our limb and this is the
Yeah.
shoulder.
Yes.
So you all agree of this? That's great. So the main lymphatic drainage of the breast will be the axillary because we have subdermal, intradermal, subcutaneous, as well as the supraclavicular, but the mainly are the axillary for the breast. That's why a female comes to you complaining about an armpit swelling. What you tell this female if she came to you with an armpit swelling? You tell her we have to examine both breasts and both axilla. And she will tell you, doctor, behave your manners. I came to you and trust you to examine my armpit only. Why you ask me about the axilla and the breast? Tell her it's the main drainage of the breast. So if anything came wrong with your breast, it will be draining to the axilla. And we have to examine both breast and both axilla. Clear? I hope this made it clear. A very simple question, yet and simple idea, but very commonly to be asked in the exam. So hope this mini session for you today added anything to you.
Yes.